Yeah. So welcome back guys in this beautiful session of screening, right? So in this particular module or in this particular session, I will be talking about the screening guys, right? So in the last topics, we have talked about the epidemiology, right? And I hope that you might have liked that as well. So in that particular playlist, we have talked about the epidemiology, descriptive, analytical, and experimental epidemiology, right? And in today's class, we are going to talk about the screening, right? So first of all, we should know what is the screening, guys. So screening is very simple. In some asymptomatic patient who is not showing any kind of signs or any kind of symptoms, right? And if we are doing some procedure, okay, or we are taking the help of some test, right, to diagnose the disease in that particular person, right? Now whether the test might come positive or the test might come negative, right, according to the body of the person, right, depends on patient to patient, depends on person to person. That is basically called as a screening. So very simple, what is screening, guys? In any asymptomatic patient who is not showing any kind of sign or symptom, okay, by the help of our intervention, for an example, we might take some help of some instrument. For example, we are having 50 persons, right? We are having a group who is in that group, we are having 50 persons, and we are actually looking for hypertensive patients. So we are actually checking the BP of each and every person, right? And let's say out of those 50 persons, right, we have found out that 10 persons was having the high BP, right? 10 patients were having the BP more than 140 by 90 or 150 by 100, right? So those are probably hypertensive, but they are unknown cases, right? So this is kind of a screening, okay? So that is the thing. Now, if we are talking about the screening, basically we are talking about the types of screening, very, very important. So guys, now we are going to start with the types of screening, right? Okay, so let's start with the types of screening. So guys, I'm gonna talk about the important types of screening now. Okay, so I hope you guys are with me, right? So types of screening, guys, first of all, I'm gonna talk about over here, that is the mass screening, right? Mass screening. And as the name suggests, right, as the name suggests, you are going to do this screening on a very large level, right? So we are gonna test a large number of people, a big number of people. So basically we are doing the screening of a whole population or a large population, right? So basically what is this? This is the screening of whole population or large population, screening of whole population or large population, right? Okay, now basically for an example, a patient is just like that. Patient is coming to you, right? Patient is coming to you and you did the chest x-ray. Patient was just having the cough, right? The patient came to you, okay? So in your mind, you might be having so many of differential diagnosis, right? So in order to confirm those diagnoses, or in order to minimize your differential diagnosis, in order to rule out other kind of differential diagnosis from your mind, you will be taking the help of some important test. And that is the part of what? That is a part of screening only. So here I am taking the example of chest x-ray for tuberculosis, for example, right? CXR means chest x-ray, okay? Just that, using that terminology. So chest x-ray for tuberculosis, for an example, right? Or you are doing the pap smear for cervical carcinoma, right? Any kind of test for the cancer, okay? Any kind of cancer, that is all you are doing for on the basis of mass screening, right? That is one example. Second one, that is your mass screening, guys, okay? Second example I am taking over here, right? That is your high risk or selective screening, okay? High risk or selective screening. Now high risk or selective screening. Now what kind of person you are considering in this particular screening type, right? These are those persons who are basically on the high age. For example, old age patient, right? And we know that older age patients are actually they are very susceptible for having the coronary artery disease, right? For the heart disease, right? They might be having the kidney issues, right? For example, CKD. They might be having, if you talk about the males, they might be having the prostate issues, right? So these people, we know that this kind of particular age group is having susceptibility for getting this particular kind of disease, right? So better to diagnose them, right? Okay, for example, mammography for the females who are actually more than 40, right? Annual screening is actually, it is advisable for those women who cross their age of about 40 years, right? We are actually saying that these kind of women, okay, they should undergo mammography, right? Annually. So this kind of thing are the high risk or the selective screening, right? For some selective age group, we are doing this particular screening, right? So that is the thing. So guys, basically what we are talking about over here, these kind of screening are actually done on the high risk group patients. So done on high risk group patient, done on high risk group patients, isn't it? Okay. Examples are very simple, guys. Examples will be very similar now, very simple now, right? So what are these? For an example, if I would say that you are actually, let's say you are actually checking for prostate cancer, right? You are checking for the prostate gland in the particularly elderly age group, right? You are checking for the CAD in the elderly age group, right? So CAD in the elderly age group, CAD in elderly age group, okay, elderly age group, or you're checking for prostate in elderly age group, elderly male age group, I would say, because obviously you will not find prostate in the females, right? Okay, in the females you might write for breast carcinoma, right? You are checking for the breast carcinoma, you're going for the mammography for the breast carcinoma. So many examples are there. I just took two only. Okay, right. I'm now moving on to the third example, guys. That is third very important kind of screening, that is your multiphasic screening, right? So multiphasic screening, let's talk about that as well. Multiphasic screening, okay, fine. So in the multiphasic screening, what we are basically talking about here, we are talking about two or more screening and we are combining them, right? Two or more screening and we are combining them. So basically this is the combination of, okay, this is the combination of two or more screening disease, right? So basically this is combination of two or more screening, right? So this is the thing. So what we are taking, we are taking the large number of people, okay, and we are doing simultaneously two kinds of screening and we are just joining them. That is your multiphasic screening, right? For example, annual health checkup, right? Example could be, so this could be the example over here, that will be annual health checkup, right? So example would be the annual health checkup, right? Okay, so basically in the multiphasic screening, what we are doing basically, right, we're actually applying two or more screening tests, okay, two or more screening tests in combination with large number of people or large number of population, right? Okay, now fourth one which I'm including, okay, these all are your MCQs actually. Fourth one, this is the prescriptive screening, guys. This is the prescriptive screening, okay. In the prescriptive screening, basically we are talking about prescriptive, it means prescription, right? Whenever the patient is coming to you, you're writing the prescription. In the prescription, what you may write? You may write several kind of investigations, you may write the drugs for the treatment of the patient, right? So either you are talking about treatment, either you are talking about making the diagnosis of the person, either you are talking about the investigation, right? All of these things comes under which kind of level of prevention, guys? Yes, we have talked about that in the concepts of health and disease. If you guys remember, very first chapter of the PSM, right? That was your primary level of prevention or secondary level of prevention. I told you screening or the diagnosis part or the treatment part is coming under the secondary level of prevention. So this particular prescriptive kind of screening is coming under which level of prevention, guys? Secondary level of prevention. So first question that might come, so that is the secondary level of prevention. So it is coming under which level of prevention, right? So this comes under secondary level of prevention, okay. So you can remember like that. Second point over here is that we wanna actually make the diagnosis as early as possible, right? So early diagnosis based on the symptoms of the patient, right? That is actually read under the prescriptive kind of screening, right? So early diagnosis based on the symptoms of patient. based on symptoms of patient. So that is the motto basically, right? Okay, now if you talk about the examples, in this case if you talk about the examples guys, so what could be the examples, right? So examples could be, for example, you are doing the neonatal screening. Okay, you are doing the neonatal screening for what? For example, you are doing the neonatal screening for hypothyroidism, right? So that could be the example. So neonatal screening for hypothyroidism, neonatal screening for hypothyroidism or hypothyroidism, right? Or you are doing what? You are checking for the, let's say, pap smear for the cervical carcinoma, right? I told you that, okay, I told you that pap smear screening for cervical carcinoma, right? I told you that thing in the secondary level of prevention example when I was talking about the concept of health and disease chapter. So over there also I have told you this example. So pap smear screening for cervical CA, cervical carcinoma. Okay, right guys. I'm moving on to the next type of screening guys now. I'm moving on to the next type of screening, that is your, okay, the fifth one, right? That is your fifth one, and that would be your prospective. This is also called as the presumptive screening. This is also called as the presumptive screening guys. Okay, right, prospective or presumptive screening. Now in this case what we are seeing basically, that we are talking about the prevention of the disease. Obviously we are talking about prevention of the disease. If the question comes which level of prevention we are talking about, if we are talking about the prospective or the presumptive screening, then your answer would be this is the primary level of prevention guys, right? So this is basically the primary level of prevention, whereas I told you that in the prescriptive one I told you that was secondary level of prevention, right? This is the primary level of prevention. Okay, what kind of example you might think of if I'm talking about this case basically? So example would be, for example, you know, you went for the blood checkup, or I would say you went for the any kind of person, or you went for the blood donation. Before the blood donation they will be running some particular test, right? For example, hepatitis test or the HIV test, right? These kind of tests. But over here the point is why they want to check this, because they want to prevent the transmission of this disease. By chance if any kind of donor is having this kind of disease, that kind of person will not be allowed to donate the blood, right? Because after all this kind of blood will be collected and it will be given to some particular recipient, right? So we don't want to transmit any kind of unnecessary infection into the recipient person, right? So basically this is which kind of screening? This is the primary level of prevention. So basically this is the presumptive screening. Basically this is the presumptive screening. Okay, fine. Now let's talk about this example. So I'm taking this particular example, right? So for example, HIV screening. Okay, so for example, screening of the blood donors, that could be for HIV screening, or that could be for any other kind of infection also. So screening of blood donors basically, right? Or you know, screening of sex workers, for example, screening of sex workers, for example, right? Or in other case, for example, some kind of patient, some kind of persons are coming from different countries, right? Different countries, and we, for the prophylaxis purpose, we are running some test, right? So that they could not prevent, they could not actually transmit the infection in any kind of particular country. So that's why these can also be the example of, so immigrants can also be the example of primary level of prevention, or I would say the prescriptive or the prospective or the presumptive screening, right? Okay, now moving further from here guys, now we shall move on to the timing of the screening. Okay, so now let's move on to the timing of the screening. Okay, so now let's move on to the timing of screening. What do I mean by timing of the screening? Basically, timing of the screening, look, very simple. Just look at this particular diagram, okay, which I'm drawing right now. For example, patient comes to you, right? Any kind of patient comes to you. You are sitting in the OPD, right? And now the patient comes to you. Now this kind of patient, right, might be having the severe symptoms. This kind of patient might be having some mild symptoms, right? For an example, let's say that this is the time where the disease onset started. Okay, this is the time where the disease onset started. Okay, disease onset, right? Disease onset, and this is the time where you can find the outcome. Okay, outcome means here the person will be having, definitely the person will be having the disease. But whenever the disease is getting the onset in the body, right, the person will not show the signs and symptoms. The person will be asymptomatic. The person will be sitting very comfortably in front of you, right? So at that point of time, you are not knowing what is actually happening inside the body, right? Basically, and you will be actually saying that this person is probably normal, this person is probably healthy, right? Now, in between the disease onset and in between the proving of the disease, that is the outcome of the disease, where you can say that definitely this person is having the disease. Okay, between this thing, what are the steps, right, which we need to talk about? So, for example, before that, there is one point which I am naming that as A point. Okay, and further, I am naming one more point, that is I am naming that as B point, and I am naming one more thing, that is C point. So let's talk about what is A, what is B, what is C. Okay, so basically A, which I am talking about over here, I am saying that the A which I am talking about here, this is the first possible point of diagnosis, where if you make the diagnosis over here, well and good, right? Well and good, because you have probably made the diagnosis much earlier, right? So basically A, let's say I'm talking about any kind of cancer, right? I'm talking about any kind of cancer. Unfortunately, we are saying that we don't have the cure for the cancer. But why is it so basically? But if you talk about, if we will be able to make the diagnosis in the earlier stages of cancer, that is for example stage 1 cancer or the stage 2 cancer, okay, it will be much easier for us to save those kind of patients, right? And there is much more scope for the survival of these kind of patient if we will be able to make the diagnosis much earlier in the stages, much earlier in the stages of any kind of cancer, right? So let's say I'm taking the example of one particular kind of cancer. Let's say I'm taking the example of breast cancer. Okay, fine. So there are stage 1, stage 2, stage 3, stage 4, like that, right? Or I'm talking about prostate cancer, or I'm talking about cervical cancer, any kind of cancer you can take. So let's say there is one A point. A point says that this is the first possible point of making the diagnosis, right? First possible point, just be with me. First possible point of making the diagnosis, first possible point of diagnosis. Okay, B point says this is the final critical point of diagnosis. It means that if you will not make the diagnosis at this point of time, you might lose your cancer patient. Okay, because then the staging will be actually that will be upgraded, and let's say if you will be able to diagnose it at point of A time, right, then you will be saying that this is the first possible point of diagnosis. It means you have diagnosed this much earlier. It means you probably might have diagnosed it in the stage 1 only, right? But in case if you could not make the diagnosis at the stage A, for example, then you are having a chance of making the diagnosis at point B. So at that point of time, if you will make the diagnosis, still you are good enough, right? Because probably you might have actually catch this particular disease in the stage 2, for example, if I'm talking about cancer, right? But if you will miss the diagnosis over here also, then the C point is the usual time of diagnosis. C point is the usual time of diagnosis. Usual time of diagnosis. Okay, it means probably you could have diagnosed it, but already it is stage 3, and you know the prognosis of the stage 3 patients of cancer are not having very good prognosis, right? So that is the particular thing over here. Okay, so let me write B also. This is the final critical point of diagnosis. Final critical point of diagnosis, right? Let's make it in the box only so that we can easily rule out, we can easily actually make the differences between these things, right? Okay, so we understood what is A point, what is B point, what is C point. Yes, now let's join the dots over here. So disease onset, first of all, you are having a chance to diagnose it at point A. That is the first possible point of diagnosis. B point, that is the final critical point of diagnosis, and C point is the usual point of usual time of diagnosis basically, right? And then you are having a full-fledged disease. Okay guys, now we are talking about some time periods over here which are very important for the exam purpose. For an example, what is the latent period? For example, what is the screening time, or what is the lead time? These kind of questions are coming very frequently in your MCQs, right? So let's talk about them. If I'm talking about the time period from the disease onset till the outcome of the disease, right, that is called as your latent period, right? That is called as your latent period. So here I'm just writing it with this purple color. So what is the latent period, guys? What is the latent period? So latent period is this much. Latent period is this much. Okay, so starting from the disease onset till the outcome, if you are talking about that much long time, that is your latent period, right? Starting of the disease in the person, right, to the appearance of the disease in the person, that is called as your latent period. Very important. Then what is your screening time and what is your lead time? Screening time is, guys, the journey from point A to point B, right? It means from the first possible point of diagnosis till the final point of diagnosis, right? That is called as the screening time. So from A to B is called as the screening time. I'm just mentioning it over here. From A to B, right? From A to B, that is your which time? That is your screening time. That is your, right? That is your which time, guys? That is your screening time. That is your screening time from A to point B. It means from first possible point of diagnosis till the final critical point of diagnosis, right? And from point A to C, from point, what I'm saying, guys, from point A to C, that is your lead time, right? That is basically your lead time. So that is your lead time. Okay. Now a very interesting thing I'm going to tell you over here. That is, yes, I'm saying that it is very nice if you will able to make the diagnosis at point A, right, rather than point B. Okay. So possibly, okay, what I'm saying now, most of the people are actually, missing their diagnosis at the point A, and many people are actually making the diagnosis at point B, isn't it? So what is basically happening over here, that if I'm saying that many kind of patients basically, they are not very comfortable at point of A, because basically what you can say over here is, how I will say that, at point A, you need to use some investigations which could be very expensive, or which could not be affordable to many kind of patients, right? So that's why the A point, making the diagnosis at point A might be much difficult, right? If you talk about point B, right, that is very common. So many of the clinicians are making their diagnosis at point B, right? And at point B, if you are making the diagnosis, this is much more affordable also, and this is much more inexpensive also as compared to point A, right? So if they're asking you what is the better point where the diagnosis should be made, that is the point B, not the point A. Why is it so? Because here at point B, the diagnosis or the investigation tool which you are using over here, because they should be ideally, they should be inexpensive, and at the same time they should be affordable to the patients as well, right? So that's why the ideal point of making the diagnosis would be your point B, okay, according to this particular scheme. Okay guys, I hope you are clear with that, right? So guys, what is the lead time? Okay, come on, what is the lead time? Okay, what I told you about the lead time, right? Yeah, so you should tell me. I told you that it is between point A to point C. I told you that it is between point A to point C, right? So now you should tell me what is lead time. Basically, it is the period, right? It is the period between first possible time of making the diagnosis, first possible time of diagnosis, or first possible time of detection of the disease, right? And the annual point of diagnosis, or the final point of diagnosis, and the annual point of diagnosis, right, or the usual point of diagnosis. Okay, that is your particularly lead time. What is the basically advantage of this? What is the advantage of this? Advantage is that it is, right, what is the advantage? It is the advantage okay, gained by, it is the advantage gained by screening, right, which is helping us in making the early diagnosis, and if we will make the early diagnosis, we will be able to treat the patient as well, right. So gained by the screening helps in making early diagnosis and treatment, helps in making early diagnosis and the treatment, right. So that is the point. Okay guys, now coming back, what is the criteria for the screening test? What should be the criteria for the screening test? So important MCQs guys, what is the lead time, what is the screening time, and what is the latent period? Okay, so latent period, I told you, from the onset of the disease in the patient to the appearance of the disease in the patient, right, that is called as the latent period, right. I told you from the first possible point of making the diagnosis to the usual point of making the diagnosis, that is called as the lead time, right. What is the screening time? From the first possible point of making the diagnosis to the usual point of making the diagnosis or final point of making the diagnosis, right. Basically, what is the screening time? First possible point of diagnosis to the final critical point of diagnosis, that is your screening time, right. First possible point of diagnosis till the usual point of diagnosis, that is your lead time. Okay, so that is the difference. Here to here screening time, here to here that is your lead time, right, and here to here that is your latent period. Okay, I hope you guys are clear with that. Now I'm moving on to the criteria which are very useful for screening test, right. So the criteria for screening test, so over here let's talk about the criteria for the screening test, right. Okay, so criteria for the screening test, criteria for the screening test, right. Okay, so if you talk about the criteria for the screening test, what I told you is they should be affordable, they should be affordable, with that they should not be very expensive, so they should be inexpensive, or they should be approachable, right, and they should be acceptable, and they should be acceptable, right. So these are the conditions for the criteria of the screening test, right. Now with that, any kind of screening test must be having three parameters. What are the three parameters? It must be having the validity, it must be having the, it must be having the, so any kind of screening test, it must be having the three parameters, right. It must be having good validity, it must be having the good accuracy, and it must be having good precision. Okay, so I was talking about any kind of screening test. Okay, it must be having three important parameters, right. What are these three important parameters? These are your first one should be that this test should be valid, it must be having the validity, then it must be having the accuracy, and then it must be having the precision, right. So let me talk about what is validity. Validity means, okay, if you talk about what is validity, by validity I simply mean that this test should be valid. What do I mean by valid? Valid means basically the test must be giving, let's say that, yeah, right. Validity means basically, let's say this is the ward of some particular patients, right. In this ward, your job was to take the BP of the patients. Okay, let's say there was 30 patients in this particular ward, right. This is the ward guys, and in this particular ward there are almost around 30 patients, there are 30 patients. Okay, and you were given job. So here let's say that we are having one ward, consultant told you that take the BP of these 30 patients, right. And while taking the BP of this 30 patient, the BP instrument, let's say it was digital instrument, right. Let's say it was digital sphygmomanometer, right, not the manual one. So here what you need to do, just you will be just taking the cuff of this particular sphygmomanometer, right. You will wrap it around the arm of the patients, right. Okay, and you will repeat it, and you just need to press the button over there, right, and automatically it will give the reading, right. So you don't need to do much thing over there. but the readings which you will be seeing in the sphygmomanometer, they should be valid actually. Okay, it should not be showing like, for example, it is showing 40 by 20 millimeter of mercury, right? For every patient, for some patient it is showing, for example, 180 by 20 millimeter of mercury, right? So this is not the valid reading, right? Valid means we know that 120 by 80 is the normal range. For some patient it might show 80 by 60, or for some patient it might show 180 by 120 if the patient is hypertensive, but it should not be showing some unusual kind of reading. If it is showing some unusual kind of reading, that means that particular instrument is not having the validity. I hope you understood what is validity. Second thing, it should be having the accuracy, right? Let's say if I am taking the BP of some hypertensive patient, it should be able to give the accurate results, right? Plus minus 10 is okay, but it should be giving the accuracy, right? For example, for every kind of patient, it is showing that 120 by 80, 120 by 80, 120 by 80. Even the hypertensive patient is there, it is showing 120 by 80. For hypertensive also, it is showing 120 by 80. So that is not the accuracy at all, right? But this reading, if I am getting 120 by 80 for every 30 patient, if I am getting this is called as high precision. High precision means getting the same readings time and again. That is called as high precision, right? That is having the high precision, but not the accuracy at all, right? So that is the thing over here. I hope you got the difference between validity. You got the difference between validity and the accuracy and the precision, right? Validity means it should be giving the valid results, not the unusual kind of readings, right? Accuracy means it should be able to tell us the normal readings, the accuracy of the results of the patient, right? It could be, I could talk about the BP instrument, I could talk about the pulse oximeter. For example, you might have many kind of pulse oximeter which are actually fake in the market, right? Because of the COVID era, right? So many kind of companies started to produce the pulse oximeter in bulk, right? So many kind of pulse oximeter there, they will be just showing the 98% as in SpO2 for everybody, right? Even the patient saturation is dropping, it will show 98. For you also it will show 98, or for some other person also it will show 98. It means it is showing that high precision. It is having the high precision because it is showing the same results again and again. But is it accurate? No, it's not having the accuracy at all, right? Is it valid? It is giving the usual reading, right? It means that validity is present over there. It is not showing like 20% or 10%. This is not valid at all, right? It is showing we know that more than 95 is normal reading as far as saturation of the patient is concerned, right? Saturation of oxygen. If it is showing 90, it means it is valid. It is having the precision because it is showing the same results again and again, but it is not accurate at all if it is showing the same reading to every patient, right? I hope you understood the idea, right? So for any kind of investigation, for any kind of screening, it should be having three important parameters. It should be having the validity, it should be having the accuracy, and it should be having the precision, right? Okay, we understood that. So that was the example which I took over here, right? Now I'm just just removing it so that you will not confuse further. Okay, fine. So now guys, let's talk about the validity. So validity, it means the result should be valid, right? Means the result should be valid. Result should be valid. Okay, what about the accuracy, guys? What about the accuracy? Accuracy means it should be giving the, right? It must represents closeness to the true or the actual value, right? Whatever value it is showing, it should be close to the true or actual value, right? So it represents closeness to true or actual value. True or actual value, guys. Fine. Okay. Then I'm moving on to one more parameter, that is the precision I told you, right? If you guys remember. So what is, guys, what is precise or precision? Precision means showing the same results again and again, time and again, right? So precision, it is also called as, okay, so precision, it is also called as reliability, right? It is also called as reliability, right? Or it is also called as repeatability, because showing the same results again and again. So repeatability, repeatability, or it can also be called as reproducibility. Okay, so that is the precision. Now, what is the definition of precision as such? I know you got the idea, but if you talk about the precision, basically here the condition is test must give consistency. The test must give the consistent results. Okay, here the test must give consistent results repeated on the same interval, right? Repeated on the same individual, repeated on the same individual under same conditions. Under same conditions, right? Okay, right? For example, taking the BP of this particular patient 3 times, right? And you know, the patient was having the rest, right? But now it is showing the results like one time 120 by 80, other time it is showing the 140 by 90, other time it is showing the 80 by 60. So that is the wrong reading, right? It is not having the precision at all. That is the thing. Okay, so once you have understood this idea, so what could be the example, guys? What could be the example? Example could be you are taking the RBS reading, right, in the successive interval, right? So for example, you are doing the RBS charting for the patient and it is not showing probably the same result, right? For example, the person is not eating, okay, the person is in front of you, so the reading should not fluctuate much. For example, now it is showing 200, so in next hour it should not show 100 only, or in next hour it should not show 300, right? So yeah, plus minus 15-20 can be there, but not much, right? So that is the thing, that is the idea behind all this, right? Okay, so now we are going to talk about some important properties of the screening test, right? So now I'm going to talk about the properties of the screening test basically. Okay, so let's begin with that.